All right, so we're recording. So this is the second CAPPI conversation that we're having. So I'm Clevenger. I'm a clinical psychologist at UAB, and I'm here with Brent Bonham, who has agreed to tell us his story. And this CAPPI conversation is part of the Center for Addiction and Pain Prevention and Intervention at UAB. And the goal of CAPPI really is just to pair a professional who works in the field of addiction with someone who has lived experience with pain or addiction and just kind of have a casual conversation about it. And the goal is to help inform the public more about addiction and pain, resources that are available to them, and ultimately just, open up the communication about it and destigmatize addiction and struggles with pain. So I'm here with Brent, who has kindly agreed to talk with us today. Brent, do you mind just introducing yourself and telling us a little bit about yourself?
Of course. So my name is Brent. I'm a recovering heroin addict. I prefer to refer to myself as a heroin addict because there's a lot of bad stigma behind that, and that is absolutely what I evolved into through my drug addiction. And, a lot of people, when they talk about their drug addiction stories, they go through these chronological orders of, I was a child and then this traumatic thing happened, or maybe this, or so on and so forth. And I don't like to present it that way because, at least in my experience, that's not how I remember it. That's not how I've experienced it. So for me, as a recovering heroin addict, it's almost as though I awoke in January 27th, 2012 in a local mental hospital. I had a health insurance that would cover me going to, I specifically was at Hillcrest. Mm-hmm. And so it would cover me being detoxed for maybe 4 to 5 days in Hillcrest. And so like when I think back on my life experience, I don't remember a ton before that date. I remember my early childhood. But around the time I started doing drugs when I was in my teens and I was prescribed a couple of different opioids and that phenomenon of craving started, it kind of becomes hazy after that until July 27th of 2012. And so, my experience was I kind of came to in this mental hospital. I didn't have shoelaces or a belt, and I had a hazy recollection that I had been homeless and I had been living under this on-ramp by 280 near Brookwood Mall, and I'd been begging on the streets for the last year. And this jarring and shocking experience of the memories of the last few years kind of slowly start to surface. Mm-hmm. And for me, that was a normal thing. Like my memories were awaking in Hillcrest, waking in Jefferson County for some petty crime like begging on the streets or something like that, awakening in some very scary conversation with my family who's trying to confront me about my drug addiction. But once I started putting in, this phenomenon of craving would take over, and it was like, not only did I somewhat lose control of what I was going to do, I lost a lot of my memories of what would happen. And so I'm sitting in this hospital bed, and I really don't know what year it is or what's going on or what my life state is. I know I have no money. I don't have a car, and I don't know what's going to happen next. And I started kind of trying to relive how I got there. Mm-hmm. And my memories that weren't these snapshot blackout drug addiction before that was a year prior to this, I had been in this fantastic sober living facility. It was Any Length Resources in Bessemer. And I'd been there for about 6 months. And I had gotten involved with the 12-step program, and I'd gotten a sponsor, but I viewed the 12-step process as kind of homework to be done at my leisure. And I became much more focused on getting a good job in a restaurant and buying a $30,000 car with $2,000 down, because that's the best thing you can do when you don't have anything to your name. Mm-hmm. And trying to build this appearance that I was okay. And I always tried to reach out to the heroin addicts around me. I always felt drawn to them. They were my people, like they were some of the only people who could understand conversations about, IV drug use and hepatitis C, and so-and-so bought dope from so-and-so bought dope from this dope dealer and died, therefore that's the dope dealer I'm going to go buy dope from. That seems insane to normal people, but heroin addicts understand all of that.
Mhm.
And I was giving a couple of them a ride to a meeting, and I remember I made the statement that nothing can make me shoot heroin today at about 6 months sober. It was
Mhm.
incredibly arrogant. And I had missed a shift at work. I didn't know. They called me. I had to drop them off, rush into my job. They suspended me for a week, but I had money. My bills were paid. Everything was fine. And I walked out of my job. I grabbed my phone. I had called my sponsor before I went in there, but I was kind of estranged from the sponsor I had. And I went and I grabbed my phone to call him a second time after being suspended from work. And suddenly the thought occurred that I should check on some of my old using buddies.
Mm.
And so I called one of them up. He was waiting on a dope dealer. He told me, it's like, man, I can be there in 30 minutes. He was like, the guy's going to be here in 20. So I made it in 15 and did some rather dangerous and illegal stuff in a car to get there that quick. And next thing I knew, I was high again. And
Yeah, and sorry, don't mean to cut you
oh,
off,
please,
but
please.
I'm curious. You said earlier, um, there's nothing that could happen today that would make me shoot up.
Yeah.
And then lo and behold, it happened. Like, what do you
3 hours later.
Yeah. Yeah. So what do you attribute that to? Like, what do you believe caused that in your
It was
experience?
a lack of understanding of the disease of addiction and a real sense of the treatment plan that was outlined for me through 12-step work and this altruistic movement and this self-examination and setting right both the harms I had caused others as well as the resentments and fears that had been driving me. Seeing that as like something that could be put off to a later date, which is really common with our people. That, I mean, like you suffer from a bad drug addiction and someone's like, look, here's what you do. Write down all the people you've ever been angry at and then figure out how you caused that. And it's like, what does that have to do with drug addiction? That time you stood that girl up on a date, you need to go make that right. What does that have to do with the fact that like I have a warrant for my arrest currently in Jefferson County? So like not really understanding that and putting that off and thinking like, well, I'm working on it slowly. And so a lot of addicts, and I definitely agree with this in my experience, describe it as basically you have this this disease of addiction that manifests in this restless, irritable, and discontent state. And it's almost like a spring, right? And so when I wake up in the hospital or jail or whatever again, it's like the spring's been reset and I'm dope sick and I'm scared and I really want to get high, but there's this kind of grace that comes where I might have a few weeks or a few months, and I can even do things to extend it, like being around other drug addicts, being in safe environments, things of that nature, trying to do things for other people, being of service for others, getting out of self, getting out of like the chaos in my head. And we'll extend that period. But left untreated, it's like that spring begins to twist and the tension builds and it slowly builds and almost subconsciously. And it manifests in these forms for me of being really arrogant, judgmental, putting others down, trying to be superior to others, and how it manifests as a personality trait. That's not true of all. I mean, some people get really down on themselves, but no matter what, it manifests in some form of lack of humility. And then eventually that spring twists and twists and twists, and the tension builds until one day something happens, like I missed a shift at my job, which my job and my money and that appearance I'm putting out is very important to me, and it snaps back.
Gotcha.
And I'm high again.
Mm-hmm.
And the firsthand experience, well, from the outside, I made the decision to call someone. They were waiting on heroin. I drove over there. I bought heroin from them. I got high. From the outside looking in, that was a conscious choice. But from the first person perspective, I remembered that I experienced that as having no control. And that when that light switch was flipped, nothing could have stopped me from getting high. And I mean that very seriously.
Yeah.
And that's one of the like tragic and misunderstood things about drug addiction is, and this is not in no way excusing behavior or anything of that nature. Like, obviously drug addicts should be held responsible for their actions and things of that. But from their perspective, I mean, it is as much a mental illness as someone with, not understanding why someone with paranoid schizophrenia thinks people are out to get them. I mean, it is truly that analogous. Like, I don't know why, but that's what needed to happen in that moment.
Yeah, so if I'm hearing you correctly, yeah, like we want to acknowledge first the real physical dependence that can happen, right? Like
Oh, absolutely.
once you're physically dependent, you're trying your best just to avoid those negative withdrawal symptoms, feeling dope sick, like you said, and so that's a real thing. But then once you get past the physical dependence, so once you detox, for example, people might assume that you're in the clear, but it sounds like you're saying, well, no, you're not, because there are a multitude of triggers that can happen or stressors that can happen that can suddenly make you vulnerable to relapsing or to using again. And when I'm,
Absolutely.
yeah, and so what it kind of, so there's something in the literature called the self-medication
Mhm.
hypothesis of addiction. And it reminds me of that. It reminds me that, yeah, when you're left to these stressors without any way of coping or without working those steps, as you said, yeah, you're at risk for using again. Is that kind of lining up with what you're saying?
Oh, absolutely. Yeah. When those cortisol levels shoot up, when the stress gets really high and left untreated, absolutely. It seems like our people really have trouble with, dealing with some of those kind of feelings and emotions and stress and and like and that misunderstanding is not just the general public. And I think this is really important for everyone to get this concept. The drug addict, more than anyone else, doesn't understand this. That's kind of a big moment for people in recovery. Is so to that point, I always thought that I was shooting dope because I mean I'd gotten strung out on pain pills, and then it was Loratab to OxyContin to fentanyl to Dilaudid, or K4 as we would call them, to heroin. That was the progression, and I was always under the impression that if I could be off it long enough and not physically withdrawing, not waking up every morning vomiting in excruciating pain, hot, cold, pouring sweat, weak. Like, if I could not wake up like that, I would be fine. In fact, I could even maybe use one time, and because that withdrawal effect does not happen from a first use. I
Right.
could even maybe use on occasion and be fine. So there's a big misunderstanding for the drug addict there that somehow, like, if I get separated from it, I'll be okay. But the reality is that there's this internal unmanageability, this internal stressors, or as I have been taught and believe, there's these, we call them character defects, but they're maladjusted survival instincts driven by fear. And these kind of animalistic reactions are what drive us to become find ourselves in these self-imposed crises we don't know how to handle. Like, for me, one of the ones I discovered through my step work was I had this thing that I really feared being alone. Like, I felt very vulnerable being alone. I was an only child. Maybe it was something from that and being picked on as a kid. Who knows? Someone made fun of me when I was 5, and it set something in my mind based on fear. But when that fear would happen, I would try to show people how valuable or cool I was, how much they needed me, or maybe what good drug connections I had, or whatever. And that was a pattern through my entire life. But what often happened was I would come across as arrogance, again, that lack of humility, that I was better than, or in some way I would push people away, and it would cause this fear to be self-fulfilling, which would drive me that much harder to show them how valuable I was. And as I would go down that cycle of pushing people more and more away, eventually I would find myself alone and being unable to deal with that fear and the wreckage that trying to avoid that fear had caused. I would shoot heroin. And
Mm-hmm.
like, those are real. But then there was this other aspect of it too. So even in that moment where, all right, I've called this guy, I've gotten high. I remember I got high, and I did it on a day when it was a Wednesday night, and they do 2 required meetings every Wednesday night. One, they would get together as a group and do like an in-house 12-step meeting. And the other one is they would do a literature study for a recovery book that we would all read. And of course, that's the day. I could have gotten high on a Tuesday and not seen anybody, No, I got high on a Wednesday when I'm going to sit with 60 other guys and 10 staff members who are all recovering drug addicts and alcoholics. And like, I remember driving back there and, I even chose to read the book in front of everybody because I'm an arrogant asshole when I'm getting high. And I fell out while reading the book, literally
Oh, wow.
unconscious, which you'll get a drug test if you do that in sober living. They will drug test you.
Yeah. I imagine.
But, and so, but I woke the next day and I was like, well, I relapsed. They didn't kick me out. I gotten high one time in 6 months. It's drug addiction. It happens sometimes. And I mean, it happens a lot of times. It's a very real factor in getting sober is that a lot of people go through relapses. So they didn't kick me out, but I thought I would be fine. But this other thing happened, this phenomenon of craving, which can manifest in kind of two ways. So for a lot of people, like they'll drink and then they find they can't stop drinking, or they'll do cocaine and they can't stop doing cocaine. And with heroin addicts, you'll try to save dope for in the morning so you're not dope sick. And you'll find that you'll end up shooting it all and risking overdose because you can't stop shooting it. So there's that phenomenon of craving.
Mm-hmm.
But when I woke up the next morning, it was explained to me too that I was going to deal with this obsession of the mind like I had never experienced before. And that's what happens to our people too. It's not just that I'm physically dope sick, but even in this controlled environment, they locked me down for a week. I didn't have access to a car. I didn't have access to a phone. The only way I left was with other people who were sober, who would take me to meetings, take me to social events. And I spent every moment of that obsessing about how I was going to get high, to the point that when that week kind of suspension was up, I had already made plans of, this is the friend I'm going to move in with. I literally woke up at 5 a.m. and packed all my stuff. So the second my keys hit my hand, I loaded my stuff up and I left to go back on another run.
Yeah.
Like, once I put in, there was nothing that was going to stop me from, and that was the run where I lost the car. I ended up homeless. I lived under a bridge.
Mm-hmm.
I went in and out of jail again. And that's kind of where I found myself, July 27th, 2012, awakened in this hospital and having that vividly remembering all of that. And then just these hazy snapshots of a very hellish year being a homeless heroin addict, willing to do anything I had to stay off sick, to not get dope sick.
Yeah.
And I think that those are really important concepts to understand there. So there's this restless, irritable, discontent, unmanageability that drives our people to seek some sort of external stimulus to get us out of self, right? Drugs. A lot of people will stop using drugs and they'll become sex addicts, or they'll be, get into gambling or whatever, like looking for some kind of external stimuli, right?
Mm-hmm.
There's that. When they put in, there's this phenomenon of craving where I remember when I got high that time, I bought 0.2 of a gram. I did a 0.5 tenth of heroin, nearly died, which is really shocking to think back to, but it'd been 6 months. And then, but I remember sitting there physically, like straining over whether or not I should do more heroin, because this phenomenon of craving had kicked in. And even though I was pretty sure I would die, God, I really wanted to do more.
Yeah.
I ended up flushing the heroin because I didn't want to take it back with me to the halfway house. But the idea that I sat for probably 2 hours and debated whether or not it was worth the risk of dying to get more high while I'm nodding in and out of consciousness, like that's that phenomenon of craving that takes hold. And then to awaken the next day, locked down in a sober living, and have that obsession of the mind of, I would have done anything, all I could think of, everything, all of it reminded me of getting high. Like that, I didn't have a choice now. I have to go get high. I have to do it.
Yeah. Yeah, those cravings and urges are so strong, so strong. And it sounds like what kind of drives those things, or maybe is related to them, is that unmanageable distress that you talk about, that irritability, that restlessness that could also be related to, not being on drugs or being on drugs. But also related to like these vulnerabilities that you talked about, like for you said there's this discomfort with being alone, and every human being on earth, right, has these vulnerabilities. And it sounds like addiction, it really preys on those vulnerabilities. It really just hooks into them and makes it hard to get out of that cycle.
Absolutely. And, maybe, and maybe this is some evolutionary thing that's gone awry that, our people back in the day strive that much harder not to be alone and that much harder to have what they need and that much harder to make sure they had food and to sexually reproduce. And maybe it helped at one time, but in a world where there are, opioids, cocaine, amphetamines, alcohol, things that can really act on it, they really seem to hijack you. And like, so I've been sober over 8 years, and I think back to that person. I don't. It almost seems like it was a different person. Like once the brain chemistry is really wrecked, the way you process, the way you react. I remember like the emotional instability of like just perceiving that maybe someone had offended me would just send me into this irate state. And for anyone who knows me before I got on drugs or having been sober, I am rarely just emotionally charged or full of rage or anger. But on drugs, I was absolutely just driven by fear, rage, anxiety, things that are not common for me when I'm sober. That there was something that kind of took hold. And I come from a family that has a history of opiate addiction. My cousin actually passed away, I think about a year ago. Yeah, about a year ago now, of a heroin overdose. I had like a great aunt who is an opiate addict. Like it runs in the family. My father wouldn't take opioids because of this. And I know for me, like when I was first exposed to these things medically, like when I was, prescribed Loratab for a broken bone or given morphine when I had a spontaneous lung collapse, that there was some wild reaction that I don't think is that normal people have of both this phenomenon of I want more, this is how I need to feel, this has solved something very internal, but also I remember one of the first times I ever recreationally took Loratabs. I had a bunch of friends here at my mother's house at the time, and I bought my mother's house. That's why I say here. I bought
Yeah.
it, but it was here actually. It was right outside here that we bought a couple of Loratabs, and I took 3 Loratabs, and they were drinking and smoking pot, and there was ecstasy and all this stuff, but I wanted more Loratabs.
Mhm.
And I made them call people, and we couldn't find any. And so I immediately chose, now again, driven by the fear of being alone, I immediately chose to keep these people out of my house because I remembered my stepfather had a lot of Loratabs here, and I didn't want to share what I was about to steal from him. This is my first time recreationally using opioids, and I'm isolating, lying to the people around me, and stealing from my family immediately. And I was not that kind of person growing up as a kid. Like I was like the kind of shy, charismatic art student, gifted in math and science, terrible in English. Like that's what I was. But let me take opiates for a day, and I became something drastically different.
Yeah, and those things that you notice, like isolating, lying, and stealing, it's almost as if those can be really good red flags for
Oh yeah.
people to know, like, oh, this is a real problem that I need to get some help for. Is that I'm curious, like what, because you've been sober for 8 years, and I'm wondering, like, what do you attribute um, that to? Like, what do you think was most helpful for you in getting into recovery?
Well, so fortunately, my mother, while they had done their best to like cut me off and that kind of stuff, she always paid for me to have some form of health insurance. So the ability to go, I need help, and be able to go into a detox, to be physically and chemically separated, because I have never stopped using without being put in jail or put in a hospital. Like that can't happen. Like there's no talking to me. There's no like, we'll lock me up in the house. Like I have to be physically restrained for about a week. But that happened, I don't know, 13 times. So that alone didn't do it. And the sober living facility, the Any Link resources, going there, or any, I mean, we're fortunate in Birmingham. There's some fantastic sober living here. But you know, back then, 8 years ago, there weren't quite as many. And so that's where I went. That absolutely created this safe environment for me to get sober. But again, I relapsed with both those two elements. I think the third element, though, was that I had come to a point, and I think that relapse in the sober living is what did it. I'd come to a point to realize these concepts I was talking about how, you know, that I was trying to escape something very internal. And when I started, I couldn't stop. And that I wasn't getting high because I was dope sick, that there was something much deeper there. So when I got sober this last time, I really went out and sought a sponsor in a 12-step program specifically, but you know, it doesn't just have to be a 12-step program. And there's religiously based 12-step programs. There's programs that are not 12-step that are more in like the Buddhist mentality. There are ones that are more, you know, cognitive behavioral therapy, whatever.
Mm-hmm.
But like I became open to really like throwing myself into that. And so with me, I got this fantastic sponsor, and I really became open to there's something deeply wrong with my perception of the world around me. And I know I will get high again. I know that deep down now. That's going to happen. I have no control over that. No one has any control over that. That is the only guarantee in my life. And really accepting that, and then being willing to go through what was a 12-step process for me, but any kind of process where there could be some real deep introspection about like what is driving me, you know, fear of being alone, and you know, reacting with this character defect, these survival instincts, you know, or you know, starting to like, I remember one big thing for me was as I went through the process, when I went through all these like resentments and such, and I analyzed them with a sponsor, and we identified all these kind of character defects, I had this wild perspective after that for about 2 weeks where I was really quiet and humble, and I walked around and I felt really connected with people around me, and it was as though I had walked around this world and I couldn't see anything, and then one day I put glasses on, and I had a totally different perspective. I felt connected with people around me, and I kind of just felt okay. And then and so pursuing that process, like really going through that process. So I think once the drug addict is at a point where they're ready, which is hard to tell, I couldn't have told you I was ready till I was ready. And I think I might have been ready a few times before that, but it's kind of like everything lining up, that you're ready, and there's a treatment option for detox, and there's a stable place to go through the process, and access to some form of process to deal with this internal unmanageability.
Yeah.
But when all that aligned, I went down that process. And like I remember one of the things for me, so I've always waited tables. That was something that I was very fortunate when one of the first times I went into treatment, some men who I'm still close to today gave me a job at a restaurant at the Summit. And I guess that silver tongue con artist in me really fell in love with like cutting up with people. I wasn't alone. I could, you know, I really fell in love with that line of work, and like, and waiting tables. But kind of like, you know, going through that process of you know, doing this introspective work and everything, I found that while I had been sober for 4 or 5 months, I would still go up to a table and I was nervous. I was scared. Like I'd go up to people and be like, you know, welcome to such and such restaurant, you know, can I start you off with something to drink? And I would physically pour sweat at every table. And, you know, I've been sober for a couple of months, and I was really working on myself, and I wasn't scared of people, and I really didn't understand what was going on. But there was still, even over halfway through this process, there was still something that wasn't treated. And I went and I made amends to my grandmother, and my grandmother is like the greatest generation, you know, lost a finger working in the factories during the war, you know, like that kind of thing. She's in her 90s now. And but I'd lived in her house, and I'd done drugs in her house and whatever, and I went and made amends to her, and I was supposed to not tell her I did drugs in her house because we didn't think she knew, but I made amends to her, like, you know, borrowing money and not paying it back and this and that. I went through this whole process. Well, anyway, come to find out, my grandmother, who she's almost entirely deaf, and so like I didn't think she could hear me, honestly. Like I started making this amends to her, and she does this thing where she'll ask you to speak up, and then if she can't hear you after that, she'll just smile and nod. And so I'm like pouring my heart and soul out, and she,
Yeah.
just like, oh my God, she's not even hearing me. I'm gonna die. I don't know what to do. I make this whole amends to her and everything, and I'm like, is there anything I left out? And she says, were you not gonna tell me you did drugs in my house? And I was kind of floored. Like, how did she know that?
Yeah.
And much like I said, all that being this kind of snapshot blackout, she started telling me about how after I moved out of her house, she found a box of 100 dirty needles under my bed, and it just like hit me like a train. Oh my God, I forgot there's a box of 100. This is
Yeah. Yeah.
a year later, 2 years later, something like that. And she starts to tell me about how every night she would lay awake at night worried that the police would come looking for me and they would search her, because of course, this sweet old woman in her what 80s at the time, that the SWAT team's going to kick her windows in and all this stuff, and
Yeah.
they're going to find those needles and she'll lose everything she owns and she'll be homeless in her 80s. And so after this tortured her for a few months, she went out in the backyard at like 4 a.m. and buried the box of
Oh,
needles,
wow.
and she wasn't going to tell me where they're at. And like the reason I tell the story is like, it floored me, and like I felt horrific. Like I caused,
Yeah. I'm
no, not
sure.
only had I caused pain while I was there, but even afterwards for months, I had literally tortured my grandmother. And of course, I
Oh,
wasn't thinking
man.
about her, I was doing drugs.
Yeah.
So I made this amends to her, and I gained this sense of empathy. That sociopathic tendency that I had while using drugs started to slip away. I saw how my actions were affecting her.
Hmm.
So then I went back to work the next day, and I walked up to my first table, and I wasn't sweating and I wasn't nervous.
Mm.
And I have not been like that to a table since. It was like a light switch that as soon as I started dealing with the wreckage of my past, and I started treating this sociopathic tendency I have while I'm on opiates and regaining this empathy, I started to lose my fear of people and fear of strangers. And once again, I became more comfortable in my own skin. And yet before that, I was unaware of how much that kind of uncomfortable fear of people was driving me to get high.
Yeah,
So
I mean, your experience, it really, it's a testimony to how 12-step programs work. They have
right,
you look at not only like your weaknesses or your flaws, or otherwise called, character defects, but also the things that you've done to people while in active
right.
addiction. And making amends is such an important process. Otherwise, yeah, it sounds like it can really come back to
Oh
haunt
yeah.
you and yeah, make you vulnerable to another relapse.
Right. And so, to kind of circle back on the original question, like, why did I get sober this time? I think it was that all these things aligned. I had the opportunity to detox. I had a safe environment, the sober living.
Hmm.
And then I was willing to go through a process and had access to a sponsor and a 12-step process, and just kind of, I was humbled enough, I was beaten enough to be willing to do whatever that man suggested of me, like making amends to my grandmother and
Yeah.
doing these really hard looks at myself. And in that process, I healed these things that were driving me to get high. It's an almost indescribable experience to go through.
Right.
Um,
Yeah, and I appreciated that you shared that, that really worked for you. And, by the way, like 12-step programs, I actually looked at their literature recently. They work just as well as any other treatment for substance use disorder. And in fact, are sometimes superior in terms of long-term outcomes. So yeah, I appreciate that you're saying, yes, this is what worked for me, with some other things. But there are other things too, like
of
cognitive
course,
behavioral therapy. And even within those types of therapies, there's similar components. Like a lot of times within those therapies, we'll bring in family members, we'll bring in people that the patient has hurt and help them work through issues that are kind of remaining, kind of like the wreckage after everything that's happened. So yeah, I think it's important, yeah, to note that you know it depends on the individual, what will work best for them, and it doesn't hurt to try multiple things and see what works.
Of course. And you know, and so my experience too is there, like after getting sober, so I got really involved in kind of my, at least from my altruistic, by the way, is the dog barking in the background annoying? Can you hear that really bad?
A little bit. It's not too bad.
Okay,
It's
because he
very
may or may
mild.
not. But so I've kind of, I mean, you know, I have like my job and my relationship in my house, and I'm a car guy, I have my car projects. But as far as my altruistic work, what do I do to try to help the community and combat this? My focus has really been with heroin addicts. And I think I got sober in kind of an interesting time that when I got sober, it was illegal for non-medical professionals to administer Narcan in the state of Alabama. That was not a thing. Vivitrol, I remember when Vivitrol first hit the scene and how incredibly controversial that was here in Alabama about whether or not sober living should even allow people to take, you know, do 12-step groups. Would we even have an opinion on if that's sober or not? You know, I remember, you know, friends going to the methadone clinics. I remember when Suboxone became a big thing and people were really, like, I remember, you know, I took Suboxone a few times when I was getting high to try to avoid dope sickness. And then like, is that sober or not? And it's been interesting. And this is not really, I mean, 12-step groups, one of the things I've always liked about them is like, they don't have opinions on outside issues. So like a properly functioning 12-step group or fellowship won't have an opinion on whether or not you're sober if you're on MAT, or, you know, whether or not you should have a certain religious view. Like that's not in their purview. They don't care about that. That's an outside issue to them.
Mm-hmm.
But it has been really interesting to watch. Like, okay, so how I met Dr. Cropsey, Karen Cropsey,
Mm-hmm.
is we were on the NPR's WBHM. They did a pills to needles thing. They had it was their Issues and Ills segment back then, and they did one on the opiate epidemic in our state. And so we were on this radio program together, and that's how we got hooked up. And at the time, she was doing this study to show that if we actually let heroin addicts and a loved one of them have Narcan and carry it with them, that it will save lives, which today seems like common sense. But that was really controversial then. I mean, this would have been like 2013, 2014, something like that. It was really controversial. And a lot of what we would do is like, I would be at like a recovery group or something, and someone would come in and they're like, maybe they'd overdose, or maybe they come in and they desperately need help. And at the time there were really very little resources available. So a couple of us from my group, we would get that heroin addict and we would go down to the UAB ER. We'd go to the Brookwood ER. We would go to UAB Highland ER, and we would sit with that person for hours. I mean, I have spent a few hundred hours sitting at UAB's ER room, and we would sit there with them, and they couldn't be accepted back then for being a drug addict. So they'd have to tell them, I'm suicidal, I'm strung out on drugs, and I kill myself. And then they would get locked down for 72 hours for observation. And we would use that as like right now they need help, and they may overdose, they may go off in the wind tomorrow. And we would use that to try to help them get sober for a few days so we could figure out what to do with them. And, but I remember, you know, like sometimes these people would sneak drugs in and they'd overdose in the hospital. Like one time a girl overdosed at Brookwood, and, you know, they administered Narcan to her. I was in the room, and, you know, as soon as they administered Narcan to her, she starts trying to attack the nurses and cussing and screaming and throwing stuff. And you could just see the frustration with the nurses. They're like, this person's choosing to get high. They use drugs. They don't want the help. We helped them. We saved her life. She's physically trying to attack. You know, you could tell they were just like, you know, there's another guy who's having a heart attack right now that we could be helping. There's a person with a gunshot wound. There's a person with a broken leg. Like, there are other people with very serious conditions in this hospital too. But this bed's being taken up here. And the sense of like, why would we want to encourage promiscuous use with Narcan? Why are we having to spend these resources, and this real lack of understanding that like I was saying, these people don't have a choice. They're kind of coming out of a blackout. And with Narcan administration, they're coming out of a blackout in excruciating pain. I
Yeah.
think if you asked most active addiction heroin addicts, hey, like, okay, actually, so I remember when I was getting high, there was a point where when I was homeless, I ran around with these two guys. We were all kind of equally shitty people. And we would always have this discussion, hey, if you overdose, do you want to be brought back? And the one guy would always base it on, well, his brother died of a heroin addiction and he didn't want to do that to his mom. So he's like, if I overdose, yeah, call an ambulance, bring me back. And then
Mhm.
the other guy who was like a 2-strike felon facing life if he got caught again, family wanted nothing to do with him. He'd like, just let me die. And they would ask me this question, and my decision over whether or not you should let me die, or I mean, think about that, like having that
Yeah.
conversation. Should you let me die or not? My total decision, I was so self-absorbed and so driven by the drug use at that point. My decision was solely based on, do I have any more drugs? Do I
Mhm.
have any more money? And if I had either one of those, then yes, absolutely bring me back because I can get high again. And that's
Mhm.
what this is all about. But if not, just let me die. Why would I want to wake up in my own personal hell again, dope sick? And that was my policy for whether or not I should live or die. And like the insanity of how much it has taken over my mind.
Yeah. Yeah, it really takes a grip. And in your story about the nurses, it reminds me of, yeah, how much progress has been done and still needs to be done when it comes to stigma, because even within the healthcare profession, there are many people who still don't quite see addiction as a disease or as a medical illness and as a choice. And
Right.
unfortunately, yeah, it impacts care. So that's definitely something that needs to continue to be worked on. Um,
Well, and I think that's some of the symptoms of the disease, right? Like when someone has cancer, they don't steal from their family, right? And or a better analogy, when someone has type 2 diabetes, they don't steal from their family, right? When someone dies from congestive heart failure, which was driven by things like type 2 diabetes and things like that, you know, they didn't like lie to their family, they didn't cheat, they didn't steal, they didn't get arrested in the process of going to buy another sugary snack or fast food, like. But
mhm.
the symptoms of this same kind of you know um, life choice driven disease that can be set off, you know we cause so much harm to society. A lot of people in society feel like we just shouldn't be there. But the thing is if you don't treat them, like for example, if you don't provide some available resources, you might have a heart attack and you can't get into the ER because we're sitting there with a heroin addict who's trying to get sober because there's nowhere else to take them, right?
Yeah.
Or if we don't treat this addiction, it's not going to go away. You're just going to have that many more people breaking into cars, that many more people begging on the streets, that many more people spreading hepatitis C and HIV. Like those things will continue to happen. So the society can either accept it and try to deal with it, or they can ignore it and let all, I mean, what was it, like West Virginia, where they had a pretty bad, a couple of years ago, they had a pretty bad HIV outbreak. I mean,
Mhm.
that stuff should not be happening in a developed world or developed country like this. But when you have a place that does everything they do to make sure that people can't get their hands on needles.
Yeah, I mean, what you're talking about, it really speaks to how beneficial harm reduction can be. And people are so uncomfortable with that term, harm reduction, like giving people clean needles so
Right.
that they're not, yeah, putting themselves at risk for, infections or, yeah, hepatitis. Um, Giving people a safe place to use so that they don't die. Narcan, yeah, all these harm reduction techniques, yeah, they make people uncomfortable because they think it means we're, saying this is okay, you have permission to continue doing this, and yeah, people have, yeah,
Yeah.
negative feelings about that. But like you're saying, it can help people. Well, one, it can prevent a lot of negative outcomes like death. Um, and
Which we've
two,
had 184 of in Jefferson County this year. Man.
yeah,
Anyway, continue.
yeah, no, yeah, and two, like help spreading out like the load so that, you're not like overloading
Yeah.
like ERs or ambulances. If lay people can administer Narcan, it can really help people not only more quickly, but just, yeah, reduce the workload in general on the healthcare system. Um, and yeah, Brent, I know we're getting close to out of time, but there was one final question I had
We
that I
are.
thought you could really speak to. So yeah, earlier you said, you identify as a recovering heroin addict. Some
Yes.
people will say like, I'm an addict. Some people will say I'm in recovery. Some people choose to say, I have a substance use disorder. And
Right.
I think it really speaks to the different labels that people can take on, and how, yeah, some people are more comfortable with a label, but not so comfortable with another. And I wonder if you can speak to that a little bit, like what you've kind of seen in the community in terms of labels for addiction and things like that.
Well, so for example, like and I think now opiate addict and heroin addict is much more acceptable term, but like when I was struggling with it 10, 15 years ago, it was not. Like it was not heroin addicts were, these homeless junkies that were, beyond repair. And some people feel like we shouldn't use the term junkie, and some people feel like we shouldn't classify ourselves as one specific group, or some people are really ashamed to call themselves, a methamphetamine addict or a heroin addict. I call myself a heroin addict because I want to be that. I came from a nice home. I was provided with, whatever, what I need. My needs were always met. But at the same time, when I got strung out on opiates, it didn't matter. And that took me to being homeless. And I was living under an on-ramp on 280 by Brookwood Mall, begging on the streets. Like that's where it took me. I am a recovering heroin addict. And I say that both because like I don't need to forget that, right? Like
Okay.
if
Yeah.
I were to start drinking, I firmly believe, based on my experience, that it will lead me back there. But two, I don't want the stigma to exist anymore. I don't want people to be ashamed. My family was not really comfortable with the fact of telling, hey, by the way, opiate addiction runs in our family. Be careful. But that stigma shouldn't exist, right? Like we should openly talk about that, but we should be letting our doctors know about that. And I want people to know that if you are struggling with a heroin addiction, if you're struggling, I never did meth, but like if you're struggling with a methamphetamine addiction, if there are people who are sober, because when I first started getting sober, when I first started trying to get help or being forced, I couldn't find sober heroin addicts. I couldn't find people out there who were like me. And I really determined that people like me were beyond help. They were beyond hope. They were set to die. And yet I know hundreds, if not thousands, of sober heroin addicts today. Like that is not our fate. So I think that's why people have different terminologies they prefer, different labels they prefer. But I am most comfortable with heroin addict and junkie because I want to try to just smash that stigma that like no
Yeah.
one's beyond aid, no one's beyond help.
Yeah, I appreciate that. I mean, that makes a lot of sense. And I think a lot of people shy away from using the term addict because it is so stigmatized. Like when I worked at a residential treatment program, for people who it was their first time at treatment, it was their first time acknowledging that they had a problem. Like the biggest hump that they often had to get over was being able to say like, I'm an alcoholic or I'm an addict. And it's amazing how powerful a label can be and like how much it
Mm-hmm.
means. Like to them it meant like I am flawed. And it sounds like what you're saying is no, like it's literally what we're dealing with. It's an addiction. It's like any other illness, and we need to just use the term and smash the stigma and don't shy away from it. And also like don't forget about it, right? Like don't forget all of your experiences that have led
Yeah.
you to your recovery. Yeah.
Well, and I'm of the generation of people where it was just don't use no matter what. Just say no. If we arrest enough, if we
Yeah.
send enough people to jail or enough people to prison, if we attack this head on, we will solve that problem. And that was going on with me as a kid. I'm a product of that generation, and yet I don't think we've ever seen drug overdose rates like we have with my generation. So like
Yeah.
at some point a society does have to start going, well, is this working?
Yeah. Well, Brent, I really appreciate you sharing this with us. It was very informative, very helpful. I appreciate the work you're doing in your community. I'm going to try to share my screen and show you and our viewers the CAPPI website. So let's see if this will work. So do you see this,
Yep,
Brent?
perfect. You
Yeah.
nailed it.
So this is the CAPPI website. So if you just go to uab.edu/CAPPI, that'll take you to the main website. And here I have our CAPPI conversations page pulled up, which is where this video will be. And we have one from earlier with a man named Michael, and we'll have plenty of other conversations added to this page. But yeah, again, we just hope that this will break down those stereotypes and just help the larger community understand addiction better. Yeah, Brent, thank you so much. If there's anything else you want to share or plug, feel free.
No, not necessarily. I would like to say that unlike when I got sober, there are a lot of wonderful places people can go now to at least find access to these resources. So like there's like Ross, or what is it, the Addiction Resource Center.
Yeah.
There are places like that where they specifically gather information of all these 12-step programs and sober livings and treatment facilities, and you call them and they try to help you get to where you need to be. And so for anyone who is struggling, or anyone who has a family member who's struggling, my first suggestion would be, to reach out to places like that and see what available resources there are. Go do research. Like, the recovery community is much more open than it used to be.
Yes, yes. And a lot of those resources you mentioned are actually on CAPPI's webpage. There's a resource page there, as well as many other pages on just research and training and addiction and pain prevention. So yeah.
Yeah, I mean, I don't mean to interrupt. That's why I was
No,
so
you don't.
excited when Dr. Cropsey was telling me about what y'all are doing. It's like, the more of this we can get, the better. Like, I'm tired of sitting in emergency rooms with heroin addicts.
Yeah, absolutely. Well, thank you again, Brent. I'm going to stop recording.